Okay, program number 29 is the marketing plan. We're going to be having these weekly meetings starting on the 15th of this month. So your DON, your admin, your BOM, your marketer, your MDS, your admission director should all keep copies and be aware of what our marketing plan is. These need to be goal-directed efforts. They need to include community mapping. Who are the home healths? Who are the hospices? What doctors are working with them in our areas? Physician recruiting is critical. We need to know, who are the physicians we're trying to go after? What are we doing to try to go after them? What's our rapport with them? Who has a better rapport with them? Who's better to approach them? What kind of stipend do we have to pay them in order to get them on board with referring us patients? And we should always be prepared that the first patients they give us will be test patients, and that it's going to be a hard case, and that our staff is going to have to go a couple extra miles with the first couple patients because those will be test patients. The other part we'll have to focus on is case manager and hospital relationships. So we need to constantly be in contact with those hospitals and know what they're thinking about us. A lot of misnomers, a lot of miscommunication happens between the resident and the hospital and us. And I can't tell you how many times I've heard stories get totally twisted around by the hospital because they didn't talk to our nurse, or they didn't talk to our DON, or our marketer didn't explain what was going on. So it's super important that we keep a thumb on the pulse of what that relationship is like, and we're correcting any misnomers or any misideas about who we are and what we're doing. It's also critical that when we send residents out to the hospital that they look clean and shaved and hair combed, and as much as possible they don't look like it looks like they're cared for at our place. If we send them out and they don't look well cared for, then the hospital is not going to be anxious to refer to us. We also need to keep track of our tours and our tour conversions, as I discussed earlier. And we need to have target discussions about who controls referrals and how many we're getting from them. So that very goal-directed, targeted discussions about who are the people that can give us referrals and why are they doing it, or why are they not. So, and we need to get to the bottom of that. And if we continue to do that week after week, sooner or later we will find solutions that work to increase our census.